Your doctor tells you your blood work is fine, and they're telling you the truth as far as the tests they ordered can show. But here's the thing, most people sitting in that waiting room never find out. The standard panel ordered at a routine physical in America regularly misses the 5 blood markers that are most predictive of the health emergencies that devastate seniors. The American Diabetes Association estimates that 96 million Americans currently have prediabetes. 80% of them have no idea, not because they haven't been to the doctor, because the right test was never ordered. A landmark study following over 1,000 adults in the Framingham Heart Study found that people with elevated levels of one specific amino acid in their blood had nearly doubled the risk of developing Alzheimer's disease years later. That test is almost never included in a standard panel. Today, I'm giving you the exact names of 5 blood tests, the precise numbers you need to see on your results, and word for word what to say to your doctor if they hesitate to order them. I'm Dr. Sarah Mitchell, and this channel is built on one purpose, giving adults over 60 the clear, evidence-based health information your doctor often doesn't have time to explain. If this is your first time here, subscribe right now so you never miss a video that might genuinely change your health. Now, let's get into these 5 tests, because the first one on this list could be the difference between catching a crisis early and facing it fully formed. The first test is called hemoglobin A1C. Most of you have had a standard fasting glucose test at some point. That test takes one measurement of your blood sugar at one moment in time, usually first thing in the morning. The problem is blood sugar fluctuates constantly throughout the day. So a single snapshot can look completely normal, even when something destructive has been building for years. The A1C works differently. It measures the average level of sugar in your blood across the previous 3 months by examining how much glucose has attached to your red blood cells. Think of it like comparing a single photograph of weather to a seasonal-long weather report. One tells you what happened one afternoon. The other tells you what's actually been going on. Here's why this test is urgent for every senior watching. Prediabetes, which means an A1C between 5.7 and 6.4%, dramatically accelerates the damage high blood sugar does silently before any formal diagnosis arrives. It damages the small blood vessels feeding your kidneys. It damages the capillaries behind your eyes. And research from the University of California, San Francisco, published in 2021, found that prediabetes accelerates cognitive decline in older adults at nearly twice the rate of normal aging. You want your A1C below 5.7%. If it's between 5.7 and 6.4, you're in the prediabetes range, and that number demands a serious conversation with your physician immediately. If your doctor only orders a standard glucose test, ask by name for the hemoglobin A1C. There are 2 separate tests, and one of them is far more informative. Do you know your current A1C number? Drop it in the comments right now. I want to see what seniors across the country are actually dealing with, and it helps every person watching know they're not alone in this. The second test is 25-hydroxyvitamin D, and this one is misunderstood by almost everyone. Vitamin D is commonly called a vitamin, but it behaves more like a hormone inside your body, actively regulating over 200 different cellular processes. According to the National Institutes of Health, more than 41% of American adults are deficient, and that rate climbs significantly after age 65 for a straightforward reason. As you age, your skin loses much of its ability to synthesize vitamin D from sunlight efficiently, and most seniors spend the majority of their time indoors. The combination creates a perfect storm of deficiency that most standard panels never catch. A major review published in the New England Journal of Medicine in 2022 linked vitamin D deficiency in adults over 60 to a 25% increased risk of bone fractures, a 19% higher rate of cardiovascular events, and a significantly accelerated rate of dementia development. Those are not minor associations. Those are numbers that should change how urgently we approach this test. Now, here's what most doctors don't tell you, and this is the part that matters most. Most labs consider anything above 20 nanogs per milliliter to be normal. But the Endocrine Society recommends that older adults maintain levels between 40 and 60 nog per milliliter for optimal bone, brain, and immune health. There is a gap between what the lab calls normal and what research calls optimal. That gap matters for your quality of life every single day. Eleanor was 68 years old when she came in complaining of persistent fatigue, aching joints, and a foggy, sluggish mental clarity that had slowly crept up on her over the previous 2 years. Her standard blood panels had been done twice during that same period. Both times, everything came back unremarkable. When we specifically ordered a 25-hydroxyvitamin D test, her level was 12 nanog per milliliter. Severely deficient. Within 5 months of supervised supplementation, her joint pain had reduced substantially, and she described feeling mentally sharper than she had in years. This is not a rare story for seniors. It is one of the most consistently correctable deficiencies I encounter. The third test is called ATES-CRP, which stands for High Sensitivity Ceractive Protein. This is a direct measure of systemic inflammation in your body. And if there's one word that explains why seniors develop heart disease, Alzheimer's disease, and certain cancers, that word is inflammation. Chronic, low-grade inflammation burns silently through your tissues for years, sometimes decades, before producing a formal diagnosis. The HSCP test can detect that fire while it's still small enough to do something about. A landmark study from Harvard Medical School following over 27,000 women found that HSCP was a stronger independent predictor of future heart attacks than LDL cholesterol. That's the number most doctors spend years obsessively tracking. Yet, HSCP is rarely included in a routine panel without a specific request. But here's what stopped me cold when I first read the research on this marker. Studies from Johns Hopkins found that adults over 65 with chronically elevated HSCP were significantly more likely to develop mild cognitive impairment within a 5 to 7 year window. The inflammation damaging your arteries is the same inflammation that degrades your brain tissue. These are not separate problems wearing separate names. You want your HSCRP below 1.0 gm per liter. Between 1.0 and 3.00 represents moderate cardiovascular risk. Above 3.0 is high risk and warrants urgent investigation. Ask your doctor specifically for the high-sensitivity version of this test, not just a standard CRP, because the high-sensitivity test can detect subtle elevations that a standard test would miss entirely. The fourth test is TSH, or thyroid-stimulating hormone. The American Thyroid Association estimates that 1 in 5 adults over age 60 has some degree of thyroid dysfunction that is either undiagnosed or inadequately treated. Your thyroid controls your metabolic rate, your energy production, your body temperature regulation, your mood, your heart rhythm, and your bowel function. When it slows down, every system slows with it. The symptoms of hypothyroidism, fatigue, unexplained weight gain, cold sensitivity, constipation, depression, and persistent brain fog so closely resemble what doctors and patients both dismiss as normal aging that it goes undetected for years in people who are quietly suffering. The standard laboratory reference range for TSH goes up to 4.5 million international units per liter. But emerging research and an increasing number of geriatric specialists argue that optimal function in older adults requires TSH between 0.4 and 2.5. Many doctors will look at a result of 3.8 and tell you it's normal, and technically, by the lab's definition, they're right. But there's a meaningful difference between being within the reference range and being optimally well. Comment below if you've ever been told your thyroid looks fine, but you still feel consistently exhausted or mentally off. I want to know how many of you are living with this right now. The fifth test is homoyine, and this is the one that most urgently needs to become a routine part of every senior's blood work. Homocyan is an amino acid that accumulates in your blood when you're deficient in B vitamins, specifically B6, B12, and folate. When it builds up, it becomes directly toxic to blood vessels and brain tissue. The original Framingham Heart Study, published in the New England Journal of Medicine, followed over 1,000 adults with an average age of 76 and found that those with homoyine levels above 14 micromoles per liter had nearly doubled the risk of developing Alzheimer's disease. Nearly double. And a 2021 international consensus statement from Alzheimer's researchers across multiple institutions concluded formally that elevated plasma homoyine is a modifiable risk factor for cognitive decline and Alzheimer's disease in older persons. The word modifiable is the important one. This is a risk factor you can actually address. There's more. The VETITO trial, a randomized controlled study from Oxford University, found that B vitamin supplementation specifically targeting homocyan reduction slowed the rate of brain shrinkage in subjects with mild cognitive impairment by 30% over 2 years compared to placebo. In participants with the highest homoyine levels at the start of the study, brain atrophy was reduced by 53% relative to the placebo group. These are not small findings. These are intervention results that should be driving widespread homocyan testing in every senior's annual panel. You want your homoyine below 10 micromoles per liter. Between 10 and 15 is moderately elevated. Above 15 is significantly elevated and requires immediate attention and treatment. Frank was 76 years old when his family brought him to me, increasingly concerned about his memory lapses and the word finding difficulties that had been worsening for roughly 2 years. His standard labs were unremarkable across the board. His homocysteine was 19.2 micromoles per liter. We began a targeted B vitamin protocol, including methylylate and methylcobalamin, the forms most effectively absorbed by older adults. 8 months later, his homocysteine had dropped to 8.7, and his daughter told me during a follow-up visit that his conversation and recall had noticeably improved. I make no promises about outcomes for any individual, but I will tell you this is a test every senior deserves to have. Here is exactly what to do before your next appointment. Write down these 5 test names on a piece of paper and bring it with you. Hemoglobin A1C 25, hydroxyvitamin D, high sensitivity, CRP TSH, homocysteine. Tell your doctor you'd like all 5 added to your next blood draw. If insurance coverage is a concern, ask about out-of-pocket pricing through Quest Diagnostics or LabCorp directly, because many of these tests cost between $15 and $40 when ordered outside of insurance. That's a small investment compared to what goes undetected without them. If your vitamin D comes back below 40 nanogs per milliliter, discuss supplementation with your physician. A common starting point for seniors is 2,000 to 4,000 IU of vitamin D3 daily taken with a meal containing fat, since vitamin D is fat-soluble and absorbs better that way. If your homocysteine is elevated, ask specifically about a B complex containing methylylate and methylcobalamin, rather than standard folic acid and cyanocobalamin, which older adults often absorb poorly. As always, consult your doctor before beginning any supplementation, particularly if you take blood thinners, kidney medications, or any thyroid hormone therapy, as interactions are possible and need to be evaluated individually. Your body sends signals long before a crisis arrives. These 5 blood tests are how you learn to read them. You don't have to wait for a heart attack to discover your inflammation has been burning for years. You don't have to accept cognitive decline as an inevitable part of aging when elevated homocysteine can be corrected in months with the right B vitamins. The information exists. The tests exist. You simply have to ask for them by name. Comment one of 3 things below right now. Comment getting tested if you're going to request these 5 tests at your next appointment. Comment your age along with which of these you've already had done, so we can see what seniors nationally are actually receiving from their doctors. Or comment sharing this if you're sending this to a family member or friend who needs to see it. If this video gave you something valuable, please subscribe. Next week, I'm covering the 7 commonly prescribed medications that new research links to accelerated memory loss in adults over 60. That is a video you will not want to miss. I'm Dr. Sarah Mitchell. Take care of yourself because no one in that exam room advocates for your health better than you.